As people age, it's common to become more forgetful. But in some cases, a failing memory, especially one that affects our ability to function well, could be a sign of dementia. Today, we'll discuss about this syndrome that affects our mental tasks such as memory and reasoning. We'll also look into what we can do to make sure we keep our memories safe. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk. Joining us on the program are Dr. Carolina Dumlao. She's a geriatrician and the president of the Philippine Society of Geriatrics and Gerontology. Also joining us is Dr. Michelle Anlacan, an adult neurologist and the president of the Alzheimer's Disease Association of the Philippines. It's good to have you both on the show. Now, we'll start first with Dr. Anlacan. What exactly is dementia? Is it a disease o talagang parte lang ito ng pagtanda ng tao?
Actually, Freddy, dementia is the umbrella term that we use for the syndrome of deteriorating memory, thinking, and behavior. No? It has to be significant enough to impair our daily activities, meaning that this is a decline from a previous level of functioning. May mga bagay na hindi nila kayang gawin because of this memory problem.
Okay. Now, dementia affects millions of people worldwide, 50 million to be exact. Dr. Dumlao, does geography have anything to do with it, or does it choose a specific gender or status in life?
Well, actually, in more developed countries, there may be more cases of dementia simply because life expectancy may be longer. But geography-wise, not so much. But we have found that people with higher educational levels may have a faster decline, although those with lower socioeconomic statuses may develop dementia more often than those with higher educational status.
Okay, now I understand dementia can affect each person in different ways. Can you expound on this and explain how dementia progresses from the early stage to the advanced stage? Still with Dr. Dumlao.
Well, dementia is very insidious in onset, no? The most common kind of dementia is Alzheimer's. So usually when this begins, the symptoms are very mild and may not be noticeable, especially to the patient herself. Oftentimes, the ones that notice it are the spouse or family members who will notice that there is some change in terms of cognitive ability. But the progress may be slow. Sometimes it can be exacerbated by traumatic events or acute illness, in which case it develops faster or it becomes more noticeable. In mild stages, again, patient and family members may not notice it, although family members may say there's something a little bit off about the loved ones. It can progress to a moderate stage, in which case even the patient herself may notice that there's something wrong, but definitely the people around her see that there is a change either in behavior or cognitive ability or everyday function. It can progress to a severe state in which patients become very dependent or have lost their control or their ability in order to make decisions, or there are behavioral changes that need to be medicated.
Now, Dr. Anlacan, one of the common signs of dementia is forgetfulness or yung pagiging makakalimutin. Bakit madalas ito mangyari sa taong may dementia?
Kasi their short-term memory is often the one that is impaired first. No? So this is a forgetfulness that impacts day-to-day living because it's the part of the brain that is usually damaged first when they have dementia. But aside from memory, they can also have drastic personality changes. They can get lost, they can get confused or disoriented, but it has to be consistent, like over several weeks or months and not just in one day or two.
We're taking a short break, but when we return, how does dementia affect the patient and their families? More in just a moment. You're watching MedTalk Health Talk right here on CNN Philippines. This is MedTalk Health Talk. I'm Dr. Freddy Gomez. Now, Dr. Dumlao, I know a lot of older people who live into their 90s and even beyond with very sharp memories. At napag-uusapan kanina na that dementia is not necessarily a part of aging. Your thoughts on this, please?
Yes, that's true. No, we tend to think that dementia or being forgetful is a normal part of aging, and that's one of the reasons why it's very hard to catch these patients in the early stages. But definitely, dementia is not a normal part of aging, and when we see it in our loved ones, especially if it has begun to affect independence or their daily activities, then we should seek consult because something is wrong.
Dr. Anlacan, if dementia is not part of normal aging, what causes it?
Well, dementia and Alzheimer's disease is a neurodegenerative disease, no? Although it's linked to age, not everyone will have it, no? But Alzheimer's disease is the most common, responsible for majority of the dementia cases worldwide. There is an abnormal protein accumulation, and these abnormal proteins effectively choke the functions of the brain, bringing about the condition. But of course, before you commit to the diagnosis, you have to work up the patient properly for reversible causes. No? So hindi basta-basta ginagamit yung term na Alzheimer's disease or dementia.
Okay, so essentially, every person with Alzheimer's disease has dementia, but not everyone with dementia has Alzheimer's. Can you explain this to us, Dr. Anlacan?
Correct, because the type of dementia depends on the cause. So Alzheimer being the most common, but there are other forms. Vascular dementia is one that happens when you have a stroke and then you have a dementia after. You may have frontotemporal dementia, which is the most common reason for young onset dementia, and Parkinson's disease dementia, which can occur after many years of having Parkinson's disease. So there are many, many forms.
Okay, now Dr. Anlacan, I think what is important for viewers to know now is what are the symptoms of Alzheimer's disease?
Forgetfulness is one of the first symptoms, forgetfulness that impacts day-to-day living. And then you can have changes in personality, very drastic changes in personality. They can get lost, they can get disoriented or very confused. And this occurs over several months.
Okay, now let's go back to dementia for a second. So there are no specific treatments for illnesses that contribute to dementia, such as Alzheimer's disease. So how does one cope with dementia in general? Are there interventions available to at least slow down the symptoms, Dr. Dumlao?
Well, of course, we go back to having a healthy lifestyle. No? Physical activity has shown that it can improve cognitive function. Same with cognitive activities. You can have mind exercises. Some institutions also offer cognitive therapy, which they can engage in. I think one of the important things would also be control of risk factors like chronic conditions such as hypertension, diabetes, cholesterol levels. These are also contributory to the development of dementia. So if early on in life we can control these diseases, then the chances of us developing dementia later on also decreases.
As Dr. Dumlao mentioned earlier, there are some stages of dementia from mild to severe. And you mentioned earlier that this is a degenerative type of disease. So does that mean that if someone reaches a certain point into their dementia, there is no turning back?
Well, definitely dementia is not an inevitable part of aging. By the time we reach 85, half will have memory problems, but the other half will not. So our goal is to be the other half, the 50% who do not have. And that's where the risk factors come into play. What we often tell patients and their families is that at the first sign that there is forgetfulness or drastic personality changes, then they should consult because they should be guided and they should be worked up as to why this is happening. Because the earlier we can institute help and treatment, then the better the outcome and the prognosis over time.
Now, you mentioned a good point. So what are some of the obvious symptoms that someone's forgetfulness is already a cause for concern?
If there are some things that they cannot do because of a memory problem, because if, for example, if you're an accountant before and you cannot balance the books anymore, so if you're a lawyer and you cannot prepare your case, or if you are a housewife and you can no longer cook like before because you forget the steps or you put salt many times during the cooking process, then those are things that are quite worrisome and that you should consult already.
Okay, now there are many factors that contribute to dementia. Some can be changed, while some can be addressed to reduce your risk. More on these after the break. We learned that many factors can contribute to dementia. While some factors can't be changed, others can be addressed. Dr. Anlacan, let's talk about this. What are the risk factors of dementia that can't be changed?
Well, you have your age. You can't change age. No? There's nobody gets younger every day, so that is not modifiable. But there are some slightly modifiable, like education. No? Studies have shown that the longer you stay in school, the better for the lower your risk for dementia. But other than that, there are many other factors that are modifiable or correctable, and that's what you need to know to decrease your risk of getting dementia.
Right, and so that would be definitely my next question. How about the risk factors that can be controlled? Dr. Anlacan, could you share that with our viewers?
Yes, this is what we want to impart to people, that most cases of dementia still occur sporadically, meaning there may be no genetic predisposition. Hindi naman kailangan mana-mana. Hindi porke yung mother mo nagkaroon, magkakaroon ka. So there are many things that you can do. Just this July, the Lancet Commissions actually outlined several modifiable risk factors for us to decrease our chances of getting dementia. And these include control of our vascular risk factors like hypertension, diabetes, obesity, smoking, and alcohol abuse. But also included are avoidance of air pollution, head injury, physical inactivity, social isolation, and hearing loss in midlife. So these are things that are very, very correctable.
Okay, just a follow-up question to that. Are the patients who are experiencing dementia or Alzheimer's, are they aware? Would they be aware of their condition, on how they are deteriorating, for that matter?
Some are aware, but some are not. Sadly, a lot are aware, so they are frustrated with the things that they can no longer do because of this memory problem. But most of them are apathetic. They don't know what's going on. They're not aware. They don't care. So it is the family's burden from then on.
Okay, now Dr. Dumlao, some types of dementia are due to things beyond our control, but there are things we can do to lower our risk of developing it. Is that correct?
Yes, like Dr. Anlacan mentioned, there are some modifiable risk factors. So if you have hypertension or diabetes, making sure that they are well controlled, having a healthy lifestyle, getting regular exercise, cessation of smoking, stopping smoking, taking just moderate alcohol, those can all be preventive of dementia or lower your chance of getting dementia.
Okay. Now, how about for caregivers, Dr. Dumlao? What are your best tips to them, especially when dealing with a family member or someone with dementia?
I think the most important thing we have to remember it's not our loved one's fault. It is the disease that is making them do these things or exhibit these behaviors. It's very tiring and very frustrating for both the patient and the family who live with dementia. And as Dr. Anlacan said, a lot of times patients are aware and they become depressed or they become frustrated. But as the dementia progresses, they also lose awareness of the disease and they have no control over what they say or what they do. Forgetfulness is actually very easy to live with. No? They can just become repetitive. What's difficult and challenging for those that take care of patients with dementia are the behavioral changes. And the behavioral changes can be aggressive, they can be combative, they can even be hurtful. No? They can say things that they don't really mean. But you always have to remember that it is not the person's fault. It's the disease that is making them exhibit this behavior. So a lot of understanding and a lot of patience and educating ourselves about what is dementia and what happens when our loved one has dementia definitely makes a difference.
Now, Dr. Dumlao, a follow-up question to that is, are family members who have no medical training, is their love for them enough to take care of their loved one with dementia? Or would you advise them to seek a specialist in order to help them or guide them, for that matter, in taking care of their loved ones with dementia?
Yeah, I wish I could say love is enough, no? But even in a marriage between two people, sometimes love is not enough. I think the number one most important is for them to educate themselves, and they can do this in a variety of ways. Of course, seeking medical consult is important. There are many doctors that treat dementia, like Dr. Anlacan, who's a neurologist, myself, who's a geriatrician, some psychiatrists will also treat dementia. There are organizations that offer modules or trainings regarding dementia, such as the Alzheimer's Disease Association of the Philippines. So I think that if you feel that you may be suffering from it or you have a loved one who has dementia, then you can go all these routes, no? Medical, so that there is correct medical guidance, and then there are a lot of online resources that you can also look at so that you can have additional learning and information about it.
Now, before I let you go, Dr. Dumlao, do you have a message for our viewers when it comes to dementia and ways to prevent it?
I think it's always important to know that prevention is the most important, no? Once the dementia is there, the treatments are just to slow down progression or to control symptoms. But right now, the sad reality is there is no cure for dementia. So what we really want is to be able to prevent it rather than run after it once it is there. So again, there's just no avoiding trying to have a healthy lifestyle for all of us while we are young.
Okay, and I'll cap this episode off with a message from Dr. Anlacan.
I think understanding what dementia is all about helps significantly, as well as anticipating the stages and the accompanying changes. And make sure that you know and are aware of the resources online. So the Facebook page and the website of the Alzheimer's Disease Association of the Philippines has infographics, videos, and modules that can help you manage patients with dementia. But it's not a substitute for medical consultation. So please do consult.
As we grow older, it's not unusual to have a slightly fading memory, but dementia is a different story altogether. It's not a normal part of aging. There are things we can do to lower our risk of developing dementia or slow it down if we already have it. Remember, treating the root cause of any disease can help optimize your biological function. Give your brain a chance to heal, recover, and keep your memory safe. We'd like to thank our guests, Dr. Carolina Dumlao, a geriatrician, and Dr. Michelle Anlacan, an adult neurologist. Thank you both for joining us on this episode of MedTalk Health Talk. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk. Stay safe, everyone.